Good morning and welcome to this WIOA Wednesday webinar. My name is Kirsten Bayer with the Illinois Center for Specialized Professional Support at Illinois State University, and I will be the moderator for today's webinar. Today's topic is Programmatic Access, WIOA Section 188, Job Center Certification and Customer Service. As a reminder, all participants are on listen-only mode. If you have questions as the webinar proceeds, please post your question in the comment box or the chat box or the question box. It's important to realize that all of those names are synonymous. So your little chat box might be named something different depending on where you're joining us today, whether you're on a laptop, a phone, or a tablet. So just be aware of that, but it's just a little text box that might be labeled question, comment, or chat, and that's where you can type any comments or questions to us, and we will have a Q&A at the end of the webinar for you. Another reminder that this webinar will be recorded. The presentation recording and all materials presented today will be available on our website within 48 hours, as well as the Illinois WorkNet website. Tomorrow, each attendee will receive a follow-up email, which will include a survey asking about today's webinar. Please provide feedback and any suggestions you have to help improve upcoming webinars. Another reminder that if you do have a faulty internet connection or experience faulty audio during today's webinar, please call in, and you can do that by accessing the telephone number that I've posted in the chat box to everyone. The telephone number is also in your initial registration email as well. And with that, I'm going to get us started off with some beginning polls that we start with every WIOA Wednesday webinar. Our first poll that we ask our attendees today is, which partner do you represent? We have Title I, Title II, Title III, other WIOA partners and stakeholders, and state or local workforce innovation board. We do apologize for the limited amount of selections. We realize there might be some people from Title IV, etc. on here. If you'd like to be more specific, you can type that in the chat, and we would be more than happy to make note of that for our analytical purposes. I'm going to give everyone about 30 more seconds to answer this poll. Okay, I'm going to go ahead and close the poll and share our results. So we have quite a few people from Title I today, which is awesome, and a few from our other partners as well. So welcome to everyone. Thank you for answering that quick poll. And then our second poll is just, where is your local area today? I'm going to go ahead and launch that. So again, we apologize for the limited amount of options. Our system only allows us to do 5 for the polls. But if you would like to be more specific, we're always interested to hear specifically where you're joining us from today, so you can type that in the chat. Okay, I'm going to go ahead and close that poll and share results. So we have quite a few people from Chicago today, and then a good overlap from the rest of Illinois, which is awesome. One second here. There we go. All right, and then I'm going to go ahead and hide the results now, and then I'm going to hand it back over to our presenters for today and introduce the first one, starting with Doug Keast. Doug, if you'd like to take it over.
Okay, thank you, Kirsten. And for everybody else that's on this call, we welcome you to our discussion on programmatic access. Our conversation today will focus on the guidance in WIOA for the accessibility of all services in the American Job Center system for anyone who might wish to use those services. This overview will include WIOA's Section 188 requirements for Job Center certification and the importance of this for customer service and its impact for all American Job Center customers and participants. Next slide, please. Brian and I are with the Workforce Innovation Technical Assistance Center, or WINTAC, and are from one of the center's organizational partners, the National Disability Institute. Brian Ingram is a subject matter expert in programmatic access, career pathways, and collaborative customer service approaches, such as the Integrated Resource Team Strategy, which was discussed in last week's presentation. I'm Doug Keast and have a similar area of expertise with Brian and its relevance to customer service and WIOA implementation. Next slide, please. The objectives for today's session will be to cover information about how the Job Center certification process, as outlined under WIOA, may provide opportunities for partnerships to deepen, leading to enhanced service alignment, and how to increase the center-based services for job seekers with a disability. We're very aware that you have teams that are already addressing the inclusiveness of your center services and career pathway models on the state level with your core programs in the state board, and with each of your local teams that provide leadership in the job center operation. Today we'll touch on guidance first, and then we'll feature a panel of folks from Iowa who've used an approach which runs parallel to the steps that many of you are taking. We hope that when you have when they have completed their presentations, there will be time for some of you in the audience to also share your experiences. Next slide, please. Our colleagues from Iowa will begin with an overview of the planning initiated at the state level, and we're very pleased that Michael Witt, the Division Administrator with Iowa Workforce Development, will be able to address this. Next slide, please. Following Michael, we'll have panels from two different local areas. The first from the Des Moines American Job Center, which was to feature Leslie McCarthy with the rehabilitation services, but she's not able to join us today, but she'll be ably supported by Sarah Bath, the workforce manager with Iowa Workforce Development, and Brian Dennis, the Title I interim director with the Iowa Employment Solutions at DMAC. Next slide, please. And after you've met the team from Des Moines, the team representing the Disability Access Committee in Marshalltown will share their approach. And this team features Eric Evans, the rehabilitation supervisor from Iowa Vocational Rehabilitation Service, Becky Hassett, the WIOA Title I director with Iowa Valley Continuing Education, Rebecca Traber, the rehabilitation associate with Iowa Vocational Rehabilitation Service, and Teresa Klosterman, the intermediary network coordinator with Iowa Vocational Rehabilitation Service. Also joining us as a late potential entry is Arturo Sanchez, the district manager from Iowa Works, and we welcome all of you. And now, as we transition to the next slide, it is my pleasure to turn this over to Mr. Brian Ingram. Brian?
Thanks, Doug. Hello, everybody. As Doug was saying, the real stars of this presentation are going to be the folks from Iowa. But let's just kind of set the table a little bit for them by looking at some of the key features of WIOA, including disability. Now, I know you guys are all aware of this, but there are 4 titles, right? Title I under WIOA. Title I, Youth, Adult, and Dislocated Worker Services, which are funded through DOL. Title II, which is Adult Education, and it's funded through the Department of Education. Title III are Wagner-Pizer services, which are funded through labor. And Title IV, Vocational Rehabilitation Services, also funded through education. So the thing that's relevant today about these 4 titles is that together they're all responsible for delivering center services, for providing center maintenance, and most importantly, in our case today, with developing a center certification process, which is what this is all about. So if we could advance the slide. And let's talk about Section 188 for a minute. What is it? Well, officially, it's a part of the WIOA legislation. And this is a quote from the link on the bottom of the slide. It prohibits discrimination on the basis of race, color, religion, sex, national origin, age, disability, let's underline that, or political affiliation or belief, or for beneficiaries, applicants, and participants only on the basis of citizenship status or participation in a WIOA Title I financially assisted program or activity. Man, that's a mouthful. But what it does is it clarifies the application of the non-discrimination and equal opportunity provisions of WIOA. And it provides a platform for uniform procedures for implementing them. In other words, it implements non-discrimination and equal opportunity provisions of WIOA. So what does that do? Well, that prohibits discrimination on the grounds across all diversity bases that includes disability. So how does it do it? It requires reasonable accommodations be provided to people with disabilities. And who does it apply to? And this is important and very relevant to our discussion today. It applies to any entity to which financial assistance under WIOA, it says Title I, but it's all titles, are extended, including state and local workforce boards, one-stop operators, service providers, eligible training providers, OJT training employers, and any programs or activities that are a part of the one-stop service delivery system. So Section 188 is a required part of the center certification process. It divides program accessibility into 3 areas of compliance. We could advance the slide. These are physical access, communication access, and programmatic access. So the implementation of WIOA has created a new service delivery environment for the 4 core partners covered under the legislation, especially when it comes to access for job seekers with disability. WIOA calls for cross-partner and cross-demographic collaboration to ensure cross-systems access. In order to provide this level of access to customers of all demographics and definitions, you need to have messaging and ideally procedural consistency across all of the services included under WIOA. And indeed, this should be the goal. This means that there's a need for WIOA partners to develop a process that reflects this new service delivery environment. Let's get back to those 3 categories: physical access, programmatic access, which includes effective communication. If you could advance the slide, please. So first, let's look at physical accessibility. It seems fairly straightforward, right? A job seeker needs to be able to access the job center, the facilities and spaces involved in the delivery of the services provided there. Physical access includes things like ramps, designated parking spaces, automatic doors, accessible workstations, bathrooms, and areas where services like workshops and meetings are conducted. This type of access is really important, right? If a customer can't physically access the center, it makes accessing the services delivered there a lot more challenging. And it's also pretty concrete. I mean, a job center is either physically accessible or it's not. Measurements can be taken, equipment can be installed, spaces can be altered to ensure that access is possible. And if administrators aren't clear on what needs to be in place to ensure physical accessibility, then we have a lot of trusted sources in the provider community that they can consult with, a few of which we've listed here. So there's always the ADA accessibility guidelines, which contains scoping and technical requirements for accessibility to buildings and facilities by individuals with disability under the ADA of 1990. You know, there's also other trusted resources that a workforce system can reach out to get this kind of information, such as state and local independent living centers, ILCs, regional ADA centers. And there's also local, the mayor's office on disability is often sometimes a good place to look. Okay, let's advance the slide. So there's programmatic accessibility. And under Section 188, one-stops must assess programmatic accessibility, in which, and this is a quote, policies, practices, and procedures must provide effective and meaningful opportunity for persons with disabilities to participate in or benefit from services and training. So this definition is different than the similar term program accessibility. That term refers to accessibility of facilities, program services, technology, and materials for individuals with disabilities. So it's kind of physical accessibility. The Section 188 definition is more encompassing and requires one-stop centers to ensure full participation of people with disabilities from policy to practice. All WIOA financially assisted programs and activities must be programmatically accessible. This includes providing reasonable accommodations for individuals with disabilities, making reasonable modifications to policies, practices, and procedures, administering programs in the most integrated setting appropriate, communicating with individuals with disabilities as effectively as with others, and providing opportunity to participate in and enjoy the benefits of that program or activity. Now, I want to look at that statement a little bit more closely. To afford individuals an equal opportunity to participate in and enjoy the benefits of the program or activity. So I'd like to put a thought in your mind. When they mention benefits, think outcomes of the program or activity. Because the overarching goal of equal access is that all individuals benefit equally from the full spectrum of services that are available in the one-stop center, and ultimately have an equal opportunity to access the employment and training outcomes associated with the services provided there. Without access to the outcomes associated with the program or activity, in my mind anyway, any definition of access can become suspect. Okay, let's move to the next slide. Now let's think about communication access, which is whatever is written or spoken must be as clear and understandable to all individuals, including those who are deaf and hard of hearing or that experience other disabilities. Communication access is required except when it would fundamentally alter the nature of the service or program or would result in undue financial or administrative burden. Now, undue burden is an interesting topic, and there's always a lot of debate over what makes undue burden, what it consists of. I just want to say that under WIOA Section 188, it is considered highly difficult to prove undue burden, especially when ensuring effective communication access. For example, providing for sign language interpreters. So some quick strategies that might help with communication access might be that workforce leadership coordinates with the deaf and hard of hearing disability partners in your community to review and survey policies and procedures for ensuring communication access, review and survey technology available, and think about staff knowledge and use of those technologies once identified, surveying one-stop center staff on their experiences with customers with diverse communication needs, and a survey of deaf or hard of hearing partners on their experiences of their constituents using workforce services in hopes of identifying training needs and to set up effective communications with customers across the spectrum of disability. Okay, if we can advance. Again, just to kind of set the table, I'd like to give you a definition of reasonable accommodation. It is modifications or adjustments to an application registration process that enables a qualified applicant registrant with a disability to be considered for the aid, benefits, or services, training, or employment that they desire, or the modification or adjustments that enable a qualified individual with a disability to perform the essential functions of a job or to receive aid, benefits, services, and training equal to that provided to qualified individuals without disability. So reasonable accommodation is about access, right? And it's about access to outcomes. It's ways that it's strategies to get folks equal access. One of the things I like to go over when I cover Section 188 is some of the ways that I've seen folks be discriminated against in different centers across the country, in a lot of ways inadvertently. Just give you some examples and let's think about it. So some examples of prohibited discrimination policies around disability would be denying a qualified applicant individual with a disability the opportunity to participate in or benefit from an aid, benefit, service, or training. Providing a qualified individual with a disability with any aid, benefit, service, or training that is not equal to what is offered to others or that is not as effective. Requiring a qualified individual with a disability to participate in a separate or a different program or activities instead of the mainstream programs or activities that they're requesting to participate in. Not administering programs and activities in the most integrated setting appropriate to the needs of qualified individuals with disabilities. And finally, not providing meaningful opportunities for seeking employment and work in competitive integrated settings. Okay, if we could advance the slide. This is kind of to sum up here my section of this training. What does all this mean? Well, it means that one-stops need an interactive process in place with their customers that includes recognizing requests. Anytime a person indicates that he or she's having a problem related to a disability or a medical condition, we should consider whether the individual is making a request for an accommodation under the ADA. We need to think about gathering information from folks who use the system and from folks who support folks who are using the system to consider how to build policies and procedures that support access. We need to explore options around choosing, implementing, and monitoring accommodation. So we need accommodation procedures in our one-stops to really ensure that folks get what they need to move forward. So under WIOA, all the core partners share some responsibilities when it comes to center administration, one of which is developing an AJC certification process. One of the certification requirements under WIOA is Section 188 compliance. And this compliance is defined by access, physical and programmatic access, which includes effective communication with all job seekers. So that's my summary, folks. And thank you for being patient and letting me set the table. I'd like to turn it back over to Doug so that we can proceed with the rest of the training. Doug?
Thank you, Brian, for that great overview of the guidance and suggestions to leadership teams in American Job Centers with ideas on how to address the inclusiveness of their services for individuals with disabilities. Could we move to the next slide, please? we thought that it would be interesting to take a look at some of the priorities that were established in the local planning with the Illinois areas. And we found a few things that were relevant to today's discussion. In 20 of your local areas, you established a priority for communication across one-stop programs, which is critical for fully inclusive services. And then in terms of frequency of priority established in work plans, we also see access to services that is timely and coordinated, that processes are streamlined and aligned, that customer information is shared, and that partners share an understanding of career pathways. All of these priorities are very relevant to success in achieving the programmatic accessibility that Brian just described. Next slide, please. So to address these priorities, these are some of the more commonly noted activities in local Illinois work plans. To realign committees to ensure that all partners are represented, to develop procedures on how information is shared across agencies, increase knowledge of career pathways using common language across partners, establish shared vision for customer service, continue to use, revise, and update existing customer satisfaction tools, use a universal intake form, and institute customer navigators. Next slide, please. So now it is time to bring in our headliners for today. Our guests will discuss Iowa's approach using disability access committees. Next slide. And to start this off, thanks so much, Michael, for joining us today, and we will turn this over to you.
Thanks, Doug. Can you hear me okay?
Yes, we can. Thanks, Mike.
Great. Well, I appreciate the invitation and the opportunity for Iowa to kind of share some of the things that we've done over the last several years. Several years ago, our state workforce development board really saw a need to address some of the issues relating to providing services to folks with disabilities across the state. And they developed a standing committee off of the state workforce development board, a disability access standing committee. That standing committee is driven by our administrator from Iowa Vocational Rehabilitation and is made up of partners, employers from the state workforce board, core partners at the state level, and other state level community stakeholders that are in the disability space, and really sat down and developed kind of a mission that we could work forward on in Iowa to address some of those issues. After they developed that mission, they set out and developed 4 goals. And those 4 goals are to ensure that Iowa's one-stop delivery system meets all accessibility requirements for individuals with disabilities, increase accessibility for individuals with disabilities to programs, services, activities of the Iowa's one-stop delivery system, to continuously improve for individuals with disabilities the provision of services within the one-stop delivery system, and improve opportunities for individuals with disabilities in competitive integrated employment. And that was really the start of our work across the state in serving folks with disabilities and really realigning our one-stop delivery system to focus on that need. Shortly after those goals were developed, we had to figure out a way that we could engage the one-stop delivery system and the AJCs across Iowa. And so back then, we took that Disability Access Committee model and engaged our local workforce development boards across the state. Back then, we had 15, and engaged those local board members on developing their own local Disability Access Committee tied to the American Job Centers. And so they started on a quest of pulling together with the lead of our Iowa Vocational Rehabilitation supervisors in each of that are tied to each of the local AJCs, pulling together the core partners, the board members, some of the board members, and again, some of the local community stakeholders in the disability space to develop those local disability access committees to really drive and move forward some of those goals from the state disability access committee. And so over time, those access committees, and you're going to hear from two of them that are doing some amazing work in Iowa, and really amazing work from all of the committees across Iowa on some of the things that they've been working on over the last several years. Doug, we've worked with WinTAC in the past through some of the integrated employment assessments, and you've helped us move things along very well. And we're very proud, even though our local area landscape has changed in Iowa over the last year. We currently have 9 local areas instead of 15. Those disability access committees continue to stay tied to each of the 15 American Job Centers, and then they work together as a team if those local areas have more than one stop to provide that information back to those local boards and to really drive what's happening. Those access committees spent a lot of time together working through facility accessibility, doing individual studies on the physical accessibility of each of the centers and working through taking care of those things. And I think you're going to hear today more about the program and service delivery side of what our access committees do. We're very proud in Iowa to have a very strong integrated service delivery model. We started that back in 2008, 2009, before WIOA came into play, where we really work together as a core partner team to deliver services to customers that walk in our doors together, all the way from when we greet a customer that comes in the door through moving folks and warm handing off throughout the system and delivery. Customers don't know who they're really working with. It could be a Title I, a Title III, or any of the other partners that are working up front and delivering services together as a team. And so the disability access committees are a great champion to that integrated service delivery model, and they really work together as a team. And you're going to hear that all of the partners work together as a team to make sure that we are providing the best service, the most accessible that we can to all of our customers, including those with disabilities. And very proud to be a part of the state committee, and very proud to be part of a local committee back then as things were going. So that's kind of the history of how things started in Iowa. And we'll turn it over to you, Doug, and let the teams share some of the amazing work that they do.
Okay, well, thanks so much, Michael. And before we move on, I just wanted to pitch a question back to you. I know with the access committees that you described, there's a really strong focus on how all of the programs that make their services available participate or are represented or have the opportunity to be included. I'm just curious, with the focus that you mentioned with aligning services to be responsive to all of the customers coming in the door, does that also have an impact with regard to the programmatic access for individuals with disabilities to all of the services available?
It does. And I think you're going to hear some of that from the two teams today on how they've worked together to figure out program and service delivery access to folks with disabilities. They have created some unique approaches and really have dived in to make sure that we have all of the accessible programs and services that we can available to customers that come in our door. And I think they'll also probably share that because of that work that they're doing across the state, it really has brought customers with disabilities into our centers more than in the past, and allowed us to serve them as an integrated team and make a bigger impact because of that work.
Awesome. Well, thanks so much, Michael. And with that, I think we'll advance the slide one more and have an opportunity to introduce you to the good folks with the Disability Access Committee with the Des Moines area. And Sarah, Brian, who do I hand this off to?
Well, Doug, I'm really shy, so I'll go first just to get over my jitters. How's that?
Okay, that sounds great, Brian. Thanks.
Okay. Well, first off, so again, this is Brian Dennis. I'm the interim director of our Title I program in the Des Moines area. I'm joined by Sarah Bath, one of the operation managers in our local area AJC, and Leslie McCarthy, who unfortunately is not with us physically, is with us in spirit, is the vocal rehab supervisor for our local area as well. So go ahead and advance the slide. So I kind of already did an introduction. So if you want to skip to the slide beyond that, there I am, such a handsome man, very, very humble. Next up, I believe you advance the slide, you will see Sarah Bath. And then beyond her, you will see Leslie McCarthy. All right. So again, we are just 3 parts of a much bigger wheel that is trying to roll better to serve our customers. So again, I have been very privileged to work with these professionals as well as some others. So as you can see, our local Disability Access Committee, obviously it consists of our core partners, so the adult dislocated worker and youth program. So in our local area, the Title I program is split between 2 providers. So you have my organization, Iowa Employment Solutions, which does the adult dislocated worker program. We have a youth provider known as Children and Families of Iowa, Title II, Title III, Title IV. We have really good engagement from both a business representative and our labor representative. We have strong persons with disabilities who remember that we have a lot of cross or intersectionality that people represent in multiple areas. We have community-based partners, and really what brings us together is that we are similarly aligned and focused on quality services, not just services, but quality services and inclusions of persons with a disability. That's kind of our guiding theme and our rah-rah moment to do the work that we do. Next slide, please. So where it all began, so I actually met Doug many years ago as part of the Disability Employment Initiative. So the state of Iowa in different areas was fortunate to have the DEI project for 6.5 years. So a few of our regions got a head start on a lot of this inclusion work through DEI. So as part of the DEI grant that we had again for 6.5 years, we really focused on inclusion of persons with disabilities, doing things such as benefits planning, work incentive, employer development, education, and training. So in this local area as well as others, we were able to get a bit of a head start with the project. We've been really able to move not only in starting some system change stuff, but really in the piece of sustainability and keeping that momentum going. Next slide. So I'm going to talk a little bit about one of the areas that Leslie was really instrumental in doing were our focus groups. So we thought before we really hit the ground running, us telling people with disabilities what they need, let's get a pulse from the community that we're trying to serve. So again, Leslie was really involved and really spearheading these, so I will try my best in her absence. Next slide. So the next, the way we want to start with these focus groups were to empower and integrate the experiences of a person with disabilities into our work. Again, we didn't want it to be us telling the community what it needed. We really wanted to get really some informed decision making from the community that we're trying to integrate. So we invited persons across several and all disability groups. So we got participation from folks that are deaf, hard of hearing, individuals who have different mobility or physical disabilities, mental health concerns, which again, if you're doing any type of inclusion work, mental health unfortunately sometimes gets overlooked, but that definitely is a really vital community to make sure that you are communicating with, because disability is disability, whether it is visible or invisible. We really want to have a cross section of individuals who we really want to hear from and get an idea of what can we do to be more effective in serving you. We invited family members, advocates, our community partners, and different stakeholders around the community to really help us understand what we're doing well and what we need to improve upon. We evaluated those results and got lots of feedback, and that fueled really two very strong guiding principles when it came to some of the work groups that we did. Next slide. Really, the central work group that came out of this was what we deemed our disability task force. So while there's a lot of leadership that sits on the Disability Access Committee, we really wanted to bring in the staff that are working day to day with our customers to, again, not only get their opinion, but to really help us understand how we can make their work more inclusive of all persons that we serve. So the Disability Task Force is our internal group, and it had representatives from our Title I provider, Title III provider, our co-located both rehab counselor is on that group. We actually had from Promise Jobs, if you're not from Iowa, the TANF case management program. Business services is that we had multiple individuals from business services on that group. And not only were they a cross-section of the different programs and services that we offer, the vast majority of this group have a lived experience with a disability. So again, not only can they speak to this from the professional provider standpoint, but also from the lived experience of what it is to have been a recipient of services, and again, speak to those lived experiences on the journey to employment. So between the focus groups and the 188, which Brian talked about, great name, by the way, Brian, is we were led to a couple things. An accessibility survey, look at our physical accessibility and our programmatic accessibility, which turned into our disability etiquette training I'm going to talk about here in just a moment. Next slide, please. So with the accessibility survey, we really wanted to remove our physical barriers and enhance, make sure that our center was hopefully a leader when it came to accommodations and accessible technology. So as you can see, there's actually a shorter list from the various things that we've done. Again, we have to make sure that if you want to serve customers with disabilities, you got to make sure that customers with disability can actually access your building, not only get to it, but actually can participate and get value from the services that are provided. So our building is, we have several low-powered doors across the building that makes our building really accessible. The building that we're in is a very long building, so we have multiple wheelchairs throughout the AJC. So customers that may need to utilize those services can get those things just so they can use, have access throughout the building. We have adjustable height workstations for customers who use chairs or just need that adjustable height. Basically, once you make something accessible, it's accessible for lots of people. So not only folks who use chairs, but there's different heights of individuals. I have a friend that's about 6'8", and trust me, an adjustable height desk is great for him. We have large screen monitors, trackball mice, high resolution keyboards, which are, again, for folks that are low to no vision, certainly low vision, they can utilize those a bit better. We have dimming lights for individuals who experience things such as migraines, folks that are on the autism spectrum. There's various groups really like to have that ability to change the light settings. We have video phones, which is great for our deaf and hard of hearing customers, where they can actually speak to someone with a sign language interpreter that can help facilitate communication. Another great piece of AT that's not listed because it is an individual. Sarah's team actually hired a workforce advisor and put in the description that they needed to be fluent in ASL. So while we do contract those services, especially for large events, we do on a day-to-day basis, Monday through Friday, have an individual in our office who is fluent in sign language that can help with those communication services. We make sure we have lots of supplies for note-taking. We have iPads, which we utilize for accessibility, for taking notes, for communication. And we did a lot of work at the beginning when we moved to our new building, really configuring for additional meeting space for individuals who need that. Partly to get into some HIPAA stuff, that if you're going to invite a person with disabilities in your office, they may talk about very disability-specific things that you want to give them the avenue for privacy, as well as going back to some of those mental health things. Sometimes folks access our center and they just need a break. They just need a moment, and we want to make sure that we give those people those safe spaces to experience our services. Next slide. From a programmatic standpoint, we really believe that the AJC is meant to serve all Iowans effectively, so that Disability Task Force and partners created a curriculum that we turned our disability etiquette curriculum. So it highlighted services for the group that you can see on the screen, and there's modules within that, and it was presented by the task force, okay? And remember that task force is comprised of folks from different partners, different organizations. So this was not just the Title I or the Title III. It was across programs and services and partners to really communicate that message to their colleagues, to their coworkers, to really ingratiate and make sure that that message stuck. It included lots of resources. Again, you will not ever know everything. We want to have lots of resources, some local, some national, and it's been used by other areas in our state. And it's one of those things that we use a lot of times. Folks are onboarding, and in the face of the pandemic, we're looking at making more of those things virtual so individuals can access them at any and all times. Next slide. Well, you've heard enough from me. So I'm going to give my partner, Sarah Bass, the opportunity to talk about our integration continuum.
Good morning, everyone. I did want to step back and talk a little bit about the disability etiquette program that we had, or the workshop that we had. For me, it was so inspiring to see all the staff that worked together. It really helped build partnerships amongst the core partners. And really just got people excited and to work together and to take more of an interest in some of those topics. As we know, it's all about knowledge and making it worth it. So they did such a really great job together, and it was just a really great training. And as we were building this this presentation, we also decided it's time to do it again. We've had it's been a couple years since we did it, and it's time to do it again due to turnover and different things like that. So just a really neat workshop that we had with that. And then the other thing that I wanted to talk about, the accessibility survey that we did. One of the neat things that we did with that is we actually used one of our labor organizations to come and help us ensure that the building was physically accessible. Absolutely. He came and did all the measuring and talked to us and really worked very hard and took a lot of time out of his day and his career to come and dedicate to ensuring that our office was accessible to all. And that just goes to show the commitment and level of commitment that we have with the partners, not just inside the office, but the members of the community that are working with us. After we had the task force get together and we had the survey go out, we were given an opportunity to review the WinTech Integration Continuum assignment, and we decided to get together that Disability Access Committee as well as some other members of all of the programs. And we really went and took this task. If you guys aren't familiar with the integration continuum, we focused on 9 different items and really looked at whether or not we were in isolation all the way up to integration and kind of measured ourselves. So with isolation, communication, coordination, and collaboration, really sat and looked at, for each of those 9 topics, where did we stand? What were we doing well? And what are some things that we can do better? And really let the staff speak to all of that. And what's been interesting is we started this about a year and a half ago. This is what we came up with is a living document. We're consistently making changes, adding, adjusting to some of the goals. So we took 3 of those topics, and it was outreach, business services, and then, do you remember what the other one was? I'm sorry. It was outreach, business services, and then I believe training.
Yes.
And so we took the topics that we felt we could do the most good and have the most sustainable impact on the center. Some of the things that we really worked on is having an updated referral process. Part of that referral process was ensuring that each team, each core partner knew what the other core partners did, how to make a referral, what an appropriate referral was. Now, this has kind of been due to technology. Some agencies don't have access to Google, some do. and really wanted to, so we purchased a system called Smart Sheets. It worked really well. It started to get a little bit.
It was one of those things that, as you can imagine, we're one of the, if not the largest AJC in the state. So what wound up happening is with staff turnover and just lots of people putting information in, we knew we need to streamline it to make our referral process more effective. So you don't always need the most bells and whistles option in the world. So we were transitioning away from Smart Sheet. Smart Sheet was great because it really helped us learn what is really the most integral core info that we need, and we're really drilling that down, where we use now a lot of Google Docs in order to make those referrals, just to again make those as streamlined and timely as possible.
Right. And just again, the biggest piece of that was educating the staff on the hows, whens, wheres, and whys. And one of the things that we do in our office is we also track those referrals, and we have goals each month that we need to meet, or that we're asking staff who can, but we also, the important thing that we remind staff, it's not necessarily about the numbers. Yes, we want to make as many referrals as we can. It's also about the quality of those referrals. So spending a lot of time working with each individual core partner on those. A lot of that education has come directly from the staff of those partners. So we've had individuals come to Wagner-Peiser, we've had both rehab individuals come to the Wagner-Peiser staff and describe it, and vice versa. Some other things that we did is we created a career pathway workshop. A lot of that was trying to gear some of the workshops that we already have in the American Job Center and make those accessible to a larger population. And when I say that specifically, I'm talking about maybe high school age and those that are not necessarily have an account in our Iowa work system. We also have another great tool, which is the Future Ready Iowa website, that offers a lot of information on training and resumes and different things like that, and trying to make it seems to be a more accessible to others that are not coming into the office, and training all staff amongst the partners to deliver this career pathway workshop. The same applies to our registered apprenticeship training. All staff members and all of the partners have gone through the registered apprenticeship training. It's a training that is really centered for the job seeker, but it explains the process of becoming a registered apprenticeship or a registered apprentice, and some of the legalities and some of how that programming works. We also worked on our core business team expansion. So each of our core partners works with businesses, and we really want it, and we have so many businesses that we work with. One of the things that we don't want is 4 different entities to go to the same employer and offer the services. So we really so this core business team, they meet monthly and talk about the employers that they're working with, and maybe they all schedule a tour to go look at a factory or a business, but really work together on marketing those businesses, and also educating those businesses on accessibility, hiring people with disabilities, and different things like that. We had a really neat event last year. It was called Hiring for Today's Workforce. This event invited employers from across the central Iowa area to come and learn more about individuals that are have disabilities, maybe and we didn't just focus on disabilities. We took a lot of the underemployed groups.
Absolutely.
And highlighted them. One of the neat things that we did after so we had seminars and workshops. After that, we had what's called a reverse job fair. If you guys haven't ever held a reverse job fair, it was a really neat experience. Basically, instead of having a job fair where the employer is standing behind the table, we have the job seeker behind the table, really selling themselves to the employer. Really, and just the feedback that we've gotten from the employers as well as the job seekers was really neat. And we've continued to offer those in different venues, but that Hiring for Today's Workforce, it was a really neat experience. So recently we just and one of the things that Brian kind of said, and that I'd like to reiterate is that this is a living document. We are continually reviewing. We meet as core partners monthly to discuss, and one of our main agenda items is, where are we at on this integration continuum? What did we say we wanted to get done? Is that working? Did it get done? What are our next steps? So it's been, as I said, it's been about a year and a half. Some of those, we just met together a couple of weeks ago and talked about, especially in light of COVID, things are been up in the air for us. Talking about what's our new world look like. And so one of the things that we're really going to focus on this year is trying to make a lot of those things virtual and explore how we can do trainings, presentations, and reach out to employers virtually, maybe delve into some of those virtual job fairs, different things like that. So right now our focus is going to be on accessibility for those virtual trainings. All right, next slide. I'm going to let Ryan do the rest of the talking.
And I hate doing it. So I know Doug, you told us to take 11 minutes. I'm sure we've well blown past that, but I just want to kind of finish up just discussing how we really, you see, we talked about a lot of the activities that we're done, and it is such a we community aspect that we look at this, is that every year we really try and honor the activities that we've done. In October, by having our NDEAM, or National Disability Employment Awareness Month, forgive me. So we host events at the AJC in October, and we really bring in the community and different partners to really talk about a lot of the things that we've done over the years. So we have a program that highlights a lot of our collaborative and partnering products that we've done. The last few years, we've had a really strong partnership with Voc Rehab to have some jointly funded internships where we're have individuals that are served by Voc Rehab that are in the 4+ program with a local school district. They have a case manager through a local nonprofit, and we enroll them in Title I to give them some paid work experiences to then transition them into hopefully paid middle skill jobs for individuals beyond the internship. The vast majority of these individuals not only are young people, but they are folks that are on benefits. So they get benefits planning, and that obviously turns to some incentive through our Ticket to Work program. We highlight a lot of employers, which really none of this is possible without employers. So we've had several employers come in that really highlight their experience of hiring individuals with a disability across the partners. So we've had individuals in healthcare. We've had companies that do skilled manufacturing. One of our local cities, their HR department has really revamped their process to really invite in more persons with disabilities. So the head of the city's HR program came and talked again about the value of hiring and integrating your workforce with persons who experience a disability. And at our most recent NDEAM event we did in October of 19, we had a state representative come in and again speak impassionately about not only getting people who experience disabilities to work, but the civic involvement, voting, participating in the community, because, you know, again, many hands make light work. So we really try and set our goals for the year and really celebrate our accomplishments and set our new agenda every October with our NDEAM event. Next slide. That is just one of my favorite things to put in almost any presentation that I do with our partners. So again, at work is what people can do that matters. And for all the legislation and requirements that we have, this really is the work we're trying to do. So next slide, please. Are there any questions? The slide after this has the contact information for myself, Sarah, and Leslie, but Doug, I'm not sure how you want to do this, but if there's anyone who wants to ask a question now, Doug, if we have time, absolutely. But again, I know we've gone long, and again, those are our contact information for each one of us.
Thanks so much, Brian, and really appreciate it. And we did did go long, but there was a lot of information there, and I've got a question or two myself, but I think we'll wait till the end. We want to give some time to the great team we have from Marshalltown that has also joined us as well. But I just want to mention that I'm impressed by the approach where the focus on all of the activity in aligning the services has done a lot to be responsive and inclusive for people with disabilities and all of the partner services, and appreciate your time. So let's move on to the next slide, and like to reintroduce you to the Disability Access Committee folks from the South Central Workforce Development Area of Marshalltown American Job Center Partnership. And Eric, we'll turn this over to you and your colleagues.
Thanks, Doug. Appreciate the invitation today. Hey, and good job to Brian and Sarah. I would like to ditto a lot of what they said, a lot of great information. I'm not going to copy exactly what they said today. I'm going to go more with the timeline going back to 2017 and just kind of try to paint you a real brief picture of what our disability access team out of the Marshalltown region, what we've really accomplished and that we're really proud of. So just to start out with, Des Moines is a very metro area, and Marshalltown is more of a rural area. However, it's very diverse. And so when everything we do, we take in diversity, I think, as well as disability and the work that we do. Just to give you a little bit more information, I was at a meeting at the Marshalltown High School, and the principal there shared that there are 50 languages spoken amongst the families that are attending there at the school. So that's pretty diverse for a town of only about 30,000 or whatever Marshalltown is. But anyway, I'm going to go back to 2017, and this was when we first kind of decided to put these disability access committees together, and we were given some direction from those above us, and we're kind of told to go run with it. And so that's what we did. Luckily in Marshalltown and our region there, our core partner managers had already done just a really fabulous job of bringing everybody together and teaming. So my job as the person that had to put together the team, I just simply asked, and people were really quick to volunteer. We've changed our team a little bit over the years just because people come and go or they have a different role. But we have some great folks from my team on today, and I hope that they'll be able to answer some questions later. They may jump in as I'm going here too. But we were very well represented by all core partners. Here in Iowa, Voc Rehab is actually divided into two different agencies. IVRS, where I'm from, is really your general Voc Rehab agency. And then we have the Department for the Blind, and we had a representative that was a great partner on our team. And also not with us today, but a great partner was our adult basic education folks. And so we're really well represented across all of our partners here. All right. Back to June 2017, really our first huge task was to take a look at the physical accessibility of the one-stop center. Keep in mind, the workforce folks had been at this center for years. And so we met and we kind of introduced the whole team to what that would look like, the ADA checklist, and just kind of had a discussion, made the preparation, got our toolkits ready, and made time to go out and do that. We broke into two teams and we did the accessibility of the building. We completed our reports, and we got back together and just talked about things and what could we fix very easily. And we were able to do that just by moving some desks around or opening up some enough room for wheelchairs. There were some pretty simple things. Unfortunately, we found that there were some things that were going to be a lot harder to remedy. And later down the road, we found out just how powerful our jobs were and our duties to the disability access team, how powerful it really was. And I'll get to that. I guess our next step would be that we had a focus group in 2017 like our folks from Des Moines talked about. This was a focus group that we brought in current, former, potential customers, as well as anybody else that had interest in attending. We even tried to bribe them with some pizza and drinks, and we did get a few folks to come in for that. And the purpose was really to discuss issues such as transportation, the restrooms, entering the building, signage, materials, formats. Were they able to take part in the workshops effectively? And we really got some great information, and we created a report, and we did utilize some of that information, and that really got us thinking about access to some of the programming there at the One Stop and also the partner agencies. Ultimately, moving forward, some of the hiccups at the One Stop Center were just too large to overcome. And the One Stop Center was forced to, or I shouldn't say forced, they did move to a temporary home while we looked for a long-term place for them to move. And that took a little bit of time, and a tornado. We went through a tornado during that stop as well. Sorry, let me think here. And so the disability access team quickly jumped in and went to the temporary location. And what we were trying to do is look for any glaring issues. We wanted to make sure that, the parking was appropriate. It was quite a bit smaller of a location, and we knew it was just going to get us by for a little while. And so that's what the team did, and ultimately that worked out okay. If you fast forward to today, the One Stop Center is in a new, beautiful location, and some more partners are located there. As a matter of fact, Voc Rehab will be moving there next month. So we're excited about getting everybody under the same roof. 2018, October, Disability Employment Month. This was our first effort at planning a nice activity as a Disability Access Committee. We saw a need for partners to get better acquainted, as well as potential employers to come find out who the partners and where the services were. And so that was basically an open house, but it did go really well, and it was fairly well attended, but it was a good start. To kind of piggyback on that, and the Disability Access Committee can't take credit for this, but in the region, we were doing monthly lunch and learns where a partner agency would come in and present about their services. The whole idea behind that was for everybody to get to know each other better, to make those good referrals. It was also a good opportunity for Disability Access to do some presentations on disability awareness, benefits of hiring those with disabilities. We also did a short presentation on assistive technology. I think that it was more specifically applications on the iPhone and iPads. Okay. The one-stop accessibility reports led to regional trainings on the ADA and how to do these physical accessibility surveys. And so any staff that really wanted to be involved with that were able to take part. And that was actually done by Paige Easton. And I don't know if Paige was with the workforce at the time or the client assistance program. Nonetheless, she's really good at these and did a nice job. And I know a lot of people got to go out and use those tools and become more acquainted. So now when they're out in the field, or maybe they're in their own building, or maybe they're out at a high school, they see these things. It's just kind of part of their culture now, that they're looking for a power door that doesn't work, or maybe a bathroom that's not set up right. And not to be the police, but maybe to be there to provide feedback or help. We can also do the same for our employers. Okay. We've seen our disability access topics starting to be integrated at this point with some of our other committees. I'll give you one example. Becky, who's on the call today, Becky chairs our youth standing committee, and I know that they brought in the AT specialist from Voc Rehab to talk about some accommodations and assistive technology that would maybe help our young folks, and maybe Becky can talk a little bit more about that here in a little bit. That's just one example. We also have a business services team meeting later today, and I think as we go out and do those tours, we're becoming more and more aware of our surroundings, and Is there ample parking? Is the signage good? Is there braille? And so I think it's just becoming more and more on our mind, which is really great. Fast forward to 2019 October, we did another disability an event, and after having some meetings, we really found that we wanted to tap more into deaf and hard of hearing, and that became a big push. So we try to combine a couple things in one big day, which I thought went really well. Our event was really to celebrate the disability employment awareness in October, and we had an employer panels that came in, and we had a business specialist come in and lead a really nice panel discussion about hiring people with disabilities. She also gave a really nice presentation about the benefits of hiring people with disabilities, as well as even just disability awareness and etiquette. Immediately after that, we had a deaf and hard of hearing roundtable led by an AT specialist. We did make sure that there were some folks there that were deaf or hard of hearing, and we really had some great conversation. And I think that what we heard from them was quite a bit different than what the employers had shared just maybe a couple hours earlier. And that there was a report put together and submitted, and that was done statewide at different roundtables or focus groups. And the good news is that really led to some things. In the Marshtown area, a sign language interpreter came in and did some training to the partners, anybody that wanted to come. And she really talked about etiquette, best practices, options, what it really looks like when somebody gets a job or they go to an interview, and really what should they have for supports rather than maybe just handing a piece of paper back and forth across the table, which really puts them at a disadvantage. Our agency, Voc Rehab here in Iowa, took this information, and we're going to be hiring 4 deaf and hard of hearing specialists across the state. At least that's our goal. And we're actively sending folks to deaf and hard of hearing training right now. We're trying to get our numbers back to where these folks are feeling comfortable coming to us. And we have actually hired a deaf counselor as well. All right. Currently, disability access, we really want to work with folks that are coming into our centers or any of our locations. We want to be able to serve them on short notice. We want to be able to, whether it's an interpreter or maybe it's an app on an iPad, we want to be able to do that quickly. By the way, as a committee, we did add 2 iPads to our center because we felt like we needed the ability for folks to communicate, whether it was through a recording device or amplification, or maybe it was an interpreting service. So we have a couple of iPads that we're through Ticket to Work dollars, and we're still working on adding applications and ways to use that. Obviously, we got to train our staff to be able to use those as well. All right. Okay, what's next? Well, there's been a lot of changes to the Disability Access Committee. We've had people take different jobs, and so we're going to be working at probably filling some of those roles and making those changes. Obviously, COVID, we haven't been meeting as much as we should. That's my fault. Like was mentioned from our Des Moines folks, the WinTAC self-assessment is something that we also did, and we're actually revising right now to kind of see where we're at. It's our committee, it's our responsibility to report that. However, it's really a core partner job to go through that. And so we're definitely doing those things as well. Our vision for the future is really to make disability awareness part of our culture, to assist those that we serve, including our employers. Example, we've got Teresa and Rebecca on today, and they primarily work in high schools. So it's our goal that they can go out and maybe recognize accommodations that maybe haven't been taken advantage of, or maybe they notice physical accessibility, or maybe they know they can recognize how we can help somebody in a job experience so they get to experience the same things as somebody without a disability. Could we step in and offer improvement to the schools? Well, we hope so. I think I've already talked about Becky and the Youth Standing Committee. Some of the same things there. And she's done a great job with that committee and integrating, I think, some of the disability access stuff because it's becoming more of our culture. We have numerous other committees, such as business services, that will be meeting later today. And, you know, it's become part of that committee as well, the way we go out and look at employers and if they're going to do interviews, we think about how can we effectively allow people to come into the one stop and do a fair interview. And let's say if they're deaf or hard of hearing or they have a vision issue, we want to be able to provide what they need so that can work better for them. Ultimately, we don't want there to be a wrong door. All of our partners should be the right door. And we want to prepare our staff that we can assist all individuals and then get them referred appropriately to the right door. We're going to continue to work on applications and for iPads. We're also working with services for communication barriers, which we're really excited about. That in theory, we could have somebody walk into any of our offices within a couple minutes. We could have up to 2 or 3 folks on the line that could help us with communication, whether it's sign language and maybe it's foreign language, all in the same call. We're working on those things right now that we hope to be able to roll out to our all partners. That's what I've got. I hope that paints a little bit of a picture for you for what our Marshtown region has been doing. That is certainly missing a lot of things, and we've done a lot more meeting, but we're really proud. I'm really proud for the team, and I'm glad the folks that made it today. And thank you for allowing me to have the opportunity to talk to everyone.
Thanks so much, Eric. That was a great presentation. I know we are a little over time for the having time for questions and maybe some sharing from some of the other attendees, but I would like, just for a couple of minutes, I know you brought a pretty full panel. I was just curious if there was anybody else that was on the panel that had something really short that they wanted to share to Eric's presentation.
Hey Doug, this is Rebecca Traver and I work for Vocational Rehabilitation. I just want to kind of piggyback on Des Moines' presentation and Eric's presentation about what really makes this work for us, I think, is collaboration, all of the different entities coming together, you know, getting out there, doing what, you know, we see needs done, and including all staff. So I think that's just been like a really good, important part of how the Disability Access Committee works, is that we know our partners, you know, we take the time to learn and just work together. So that is something that has really helped, I think, us be successful in this area. I just wanted to kind of throw that out there.
Oh, that's really awesome. Thank you. Okay, well, we don't have as much time left as we had planned. I would like to open it up for questions, but also I know that we have the capacity, if there's somebody from one of the Illinois centers that would like to share a little bit about your practices too, we can unmute you. Just let us know if you'd like to share some of your experience or activity along the lines of addressing programmatic access in your American Job Centers. We'll give you a few minutes to either put something in the question box or okay. Well, I don't
see any questions coming through, Doug.
Okay, well then I'm gonna ask a question, and if any others come in the meantime, and Brian, if you got any too, but I was real curious. I know Eric, you mentioned increasing staff that are ASL certified, and in Des Moines you mentioned hiring a workforce advisor that's ASL certified, and I just wondered, with that activity, are you seeing increased numbers of people that are deaf coming into the job center as a result of that, or are you doing outreach to the deaf community to engage them at a higher level now?
I think we're at the beginning of all that, to be honest with you, Doug. And I don't know that we're seeing a big increase in Marshalltown. We do have the School for the Deaf here in Iowa over on the west side, and I think things are going pretty well over there. I think we're seeing a lot more referrals coming out of that school when they return all over. And I'm wondering if maybe Des Moines is seeing a bit of an increase at this point, because our counselor is actually in Des Moines, and I think that the folks are feeling a lot more comfortable working with Voc Rehab and hopefully some of our partner agencies, because they're dealing with somebody that speaks their language.
So over here in Des Moines, as you can guess, the first thing I'm going to say is we had a lot of building momentum, but then obviously the pandemic hit. But yes, to your point is that our ASL interpreter has, and again, the benefit of bringing one on staff is that she has a lot of connections with that community. So yes, definitely her presence has spurred on more individuals who are deaf or hard of hearing accessing the center and using her services. Also, we see a greater turnout when we do bigger like outreach events or job fairs. I know one of her goals with our support is doing like a deaf job club, but again, the pandemic has really slowed a lot of those face-to-face activities down. But yes, absolutely, when you have that service offer, especially someone with their footprint in the community, it definitely has increased our flow. And hopefully once our nation can recover from the pandemic, we're going to pick up that momentum again.
Okay. We do have a question from Renee Rankin. She's asking, are there any photos available of the assistive technology in the centers? And I regret that we didn't put your contact information into the presentation. I'm wondering, Sarah or Brian, I know you talked extensively about the assistive technology. Would you be willing to share your email address with the folks on the call with Renee's?
Absolutely. It's in one of our slides in our presentation. I think it's the final one we have, but we can also push that back out. Sarah pointed at me when you mentioned the photos that we were going to do photos. I'm like, oh no, we've got all this other stuff that we want to talk about. So yes, that's Brian's bad. But we can definitely push out photos of the different assistive technology that we use here in our center. And again, our email should be in our portion of the presentation. And if it's not, we can definitely share back. I can put it in the chat.
Okay, and Renee, you can download the presentation too through this. So I think making that direct connection could get you what you're looking for. Thanks, Renee. Are there any other questions? There was one. I'm curious. This was from Renee, also curious on successful layouts. I'm not sure I understand that question. You might have to ask it again, unless somebody on the panels understands. No?
Becky, the Title I Director. I'm wondering if, Renee, you mean the successful layout of the center? And there is the ADA checklist that really goes through each area where you can assess what that layout should really look like.
Okay, and Renee says it was connected to the photos.
Gotcha.
So I'm thinking she's maybe thinking of seeing how the assistive technology is included in the service area. Okay, are there any other questions? I know that if we could advance the slide and past there, the key resources. Here's with the job accommodation network. There's some information with the ADA national network and the LEAD Center. There's some good resources too with ways to look at your programmatic access. And Brian, I know you've had a lot of experience with using referring to these resources. Is there anything that you would like to add or point out with regard to available checklists that folks can use, or does this link, one of these links, get to what was referred to?
Yeah, I mean, I think the best bet is to get a group together like our panelists did and to embrace that ADA checklist and take a good, honest look at your facilities. And I mean, I think that was one of the examples we heard today, was that some of them were able to be brought up to code, and in one case they had to move to a new facility in order to do it. I do have another question though, Doug.
Oh, go ahead.
It would be for any of the panelists. You guys described a pretty, yeah, what's the word I'm looking for? A pretty operational process around working with your partners to try to enhance accessibility in the job center. And my question is, do you think that going through this process at a systems level actually had an impact at the case manager, counselor, staff, and customer level as far as co-enrollment and working together around shared customers with multiple challenges? I should probably direct that to someone, but I'm not gonna. I'm gonna let whoever would like to answer.
Well, pardon me. Well, coming from Brian and Sarah, I think we definitely saw that. Again, we had the DEI grant that was which one of our outcomes were co-enrollments and IRTs. But when leadership got together, one of the first things that we realized is that we want our referrals and our co-enrollments to really reflect the work. We have to get the staff who are seeing the customers around each other. So we do a lot of co-sponsored training where individuals honestly just go into a training, you sit with people from other partners, and you get to know each other and you understand what each side does, so you have those co-enrollments that happen back and forth. It is as much as we probably don't say this, people honestly don't refer to programs, they refer to people. So the Title IV people, I know the workforce folks, I know they do good work. I'll send you over because Joe works there. And the same thing the other way. So including Title II and as well. That's what really spurs it on. The way you get to that is having the individuals, the boots on the ground, the case management, the advisors really working together through trainings and opportunities, really to network and get to know each other.
Excellent, thank you.
Okay, that was a great question and a great response. Are there any other questions from the audience? I know that Illinois folks, you've been real active with the Disability Employment Initiative project. I think you've been involved with 3 separate rounds as well too. So a number of you out there can probably relate pretty closely with some of the examples that Brian talked about with Des Moines' experience. Anything else? Well, I think this wraps it up for us. Kirsten, do we have another slide?
Just
Nope.
some contact information for you and Brian.
Okay, and again, if anybody would like to follow up with Brian or I, and if you didn't get it through this PowerPoint and need to get in contact with either of us or one of the panelists, just let us know, and we would look forward to talking with you further. And at this point, Kirsten, I think this wraps it up for us. Thank you so much for allowing us to join you this morning.
Awesome. Thank you, everyone. I just wanted to reiterate that this webinar was recorded and it will be up on our Illinois Center for Specialized Support website, and it will also be on the Illinois WorkNet website as well within 48 hours. And you'll receive a follow-up survey tomorrow as well. So if you could take that, that would be great. And with that, I'm going to close this out. Everyone have a great rest of your Wednesday.